Welcome to the Board of Health meeting of July 18th, 2022. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's July 16th, 2022 signing of an act relative to extending certain COVID measures adopted during the state of emergency during the extensions of March 12, 2020 and July 15, 2022, orders suspending certain provisions of the Open Meeting Law, General Law 30A, Section 20, until March 31st, 2023. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 1-508-945-4410. The conference ID is 519-975-426#, or they can join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. I'll turn the meeting over to our chairman, Dr. Noble Hanson.
I'll open the meeting. It shall be the policy of this board to conduct its meeting under the Open Meetings Law so as to encourage public participation whenever time permits and as part of agenda item discussions. So tonight we have 5 items on the agenda, and first we'll establish that we have a quorum, so maybe just take a vote. Are you present, Ed? You present?
Present.
Present. Ron?
Present.
Carol?
Present.
John?
Present.
And I'm present. So the first hearing is a variance for Eugene Brown and Newell Bishop. Trustees 12 Mistover Lane and Coastal Engineering, I think, is going to present this. And if are they on the call?
Yes, good afternoon. This is Taria McGrail with Coastal Engineering. Can you hear me?
Yes.
Great. So the proposed project that's before you this evening is to replace an existing cesspool with a Title V compliant sewage disposal system. There's no changes proposed to the existing dwelling. It's a 5-bedroom dwelling. There's no changes to the dwelling. This is purely an effort to remove an existing cesspool and replace it with a new septic system. Due to the size of the lot and the location of the proposed system, we're here to request a variance from Chatham Board of Health Regulations 4.2 to allow the soil absorption system to be at 76 feet from the top of the coastal bank. The existing cesspool is located just near the boathouse that is on the property at about 42 feet from the top of the coastal bank. So this proposed location of the soil absorption system will be an increase in horizontal distance from the top of the coastal bank, moving to 76 feet from the bank. The system will include traditional Title V gravity system. Are there any questions?
Questions from the board members? I'll start off just with a couple. I guess one question, just a generic question, is can the septic system be moved any closer to the house to lessen the variance you need from the WRA?
So we initially looked at an opportunity to site it up around the 100-foot buffer and actually upland of that, and met with contractors and found out that due to the existing condition of this very old house and the informal foundation that's beneath it, that it was going to be difficult to install it within close proximity to the existing dwelling, and there was fear of compromising that existing building's support. That's why the location as proposed is shown.
Okay, and so they're replacing a cesspool with a Title V system, and they're not increasing the number of bedrooms. So any comments or questions from the board? Judy has given us a recommendation to approve.
Well, I'm pleased that at least you have increased the separation by moving it where you have decided to move it to, so that's a net plus. How old is this cesspool? Do we know?
I believe the owner had told me that it might date back to the 60s or 70s.
Okay.
It's quite old. They've been worried about it for some time, and really are looking forward to putting in a system that they know is better.
Has there been any failing of the old cesspool involved with surface pooling of waste or anything like that?
I have not been notified of any of those conditions, no.
Okay.
Okay, if there aren't other questions from the board, can we get a motion?
I'll make a motion to approve.
And second?
I'll second.
Okay,
Read the conditions.
we'll get, maybe, you can read conditions, and then we'll get input from the public.
So the conditions I recommended is that the property should be restricted to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Register of Deeds. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan, and then no alteration of the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent.
Okay, and is there anyone from the public who has a question or some input? Okay, hearing none, I guess we can go ahead and take a vote, and maybe just a voice vote. All in favor, say aye.
Aye.
All opposed, say no. Okay, that variance is granted, and you're all set.
Thank you.
Okay. And the next variance is for Daniel and Catherine Ward, 170 Main Street. Clark Engineering is here to present.
Good afternoon, David Clark, Clark Engineering on behalf of the wards.
Is your mic on?
Yeah, it sounds like it.
Okay.
So, the wards just purchased this property from the Odiaga family. The Odiagas were here, has formerly owned by the Odiagas since the 1970. The family had to sell the property because they didn't have the financial resources to deal with the upgrade of the septic system. You can see on our site plan, there was an old cesspool that was used as a septic tank and a new leach field added back in, I think, 1983. That is down in the lawn area on the low spot of near the low spot of the property. So the
David, could you speak up a little bit? You're kind of hard to hear.
Here, you gotta get the mat down.
get right down on top of the microphone. So the wards purchased the property and assumed the responsibility of upgrading to Title V. Looking at the property, if you've been out there, you see we're very constrained as to where to put a Title V system. We looked at initially in the front yard, but as you see, the house is extremely close to the street. The water main for municipal water is on our side of the street. A system in that location will require an overdig, so we can't get very close to that water main without undermining it. We even looked at using a different IA technology for leaching technology, basically a drip dispersal system. Their approved technology allows for the system to be 5 feet from the foundation. But their approval does not include any relief from property line. So we would have to ask for a variance anyways to the property line. The other issue with using that drip dispersal system is that you can't really plant anything on top of it or within 5 feet of it. So that would eliminate all foundation plantings and any plantings between the house and the street. And that way, we feel that would dramatically change the aesthetics of Main Street. And finally, there's just not enough room there to put in the required linear feet of infiltration piping. The manufacturer and their approval with DEP requires a minimum of 400 linear feet. So we would have to wrap that drip dispersal system around the north side of the house, where we have the same issue with vegetation. The water main that on Andrew Harding's Lane is on our side of the road in that location also. So really, the only place we had left was approximately where the existing system is, which would be on the Chatham Harbor side of the house. Your newly passed regulation regarding placement of an upgrade system within the floodplain requires that the fill on top be 1 foot above the floodplain. We're in the elevation 15 flood zone here. So that means the finished grade over the system is elevation 16. That's why we have the fairly tall retaining wall between the house and the easterly property line. That wall in its highest spot, or the highest, or the greatest amount of reveal is 10 feet.
Wow.
So from the low spot to the top of the wall, we have 10 feet. So we feel, we also looked at shortening up the distance between the leach field and the retaining wall. We have 10 feet there. That's what the code suggests. It's not a requirement. But given the height of the wall, the footings of that retaining wall are going to be significantly inboard above the outer edge of that wall, probably at least 8 feet. So you can't have the footing underneath any portion of the leach field. So that's why we're maintaining the 10-foot distance separation between the leach field and the retaining wall. It's a dramatic change to the property, but we feel it's what's required to get a Title V system on this property.
They can have green grass on top of this system,
Yeah.
true?
Yes.
So that this could actually create an elevated backyard of
Yes, it's
sorts.
not the intent of the design, but it is a result of it, yeah. They kind of like the lawn that they have now. It's a play area for kids, well,
Gotcha.
like their kids are grown, but the grandkids, they call it their ball field, so they're losing that.
Other questions from board members or comments?
This is a tough one. It really is.
The bunk room,
Say that, Ed, say that again?
bunk room?
Mike?
Microphone.
The bunk room. It's got a bath and laundry and,
Yep, that's our fourth bedroom.
That's all existing, though. No additional bedrooms are being proposed, Ed?
okay.
No.
Just in follow-up with the bedroom, I count 4 bedrooms, and then there's a gym. Is the gym considered the 5th bedroom?
We are considering it the fifth bedroom because the sitting area in the existing house is basically the same space, is considered the fifth bedroom.
Okay. And then, so basically, we're substituting a cesspool for the septic, Title V septic, which is farther away from the water resource area. But I couldn't, can you briefly say why you couldn't put it on the side of the house and move it up?
There's just not enough room. Using that drip dispersal technology, we wouldn't be able to, we fit it on just one side of the house. We'd have to wrap it around the corner, and we would have to maintain the yard so that there's no vegetation over it and not even any the impervious surfaces, because the technology's permit does not allow for impervious material over the leaching facility.
So I would just say, they're asking for significant variances, but you are substituting a cesspool that's
Yep.
closer to the water.
They've got to work
with this
within the...
Title V.
Yeah.
So are there any other questions, or Judy has given us a recommendation to approve. Any other comments or questions from the board?
Judy, is the reason that we have a 5-bedroom dwelling on such a small parcel of land because this goes back so many years, long before?
Yeah, it's an existing dwelling.
Yep.
Definitely. And the way we count rooms now, it's
Yep.
considered 5 bedrooms. And,
Okay.
I mean, David went over the fact that they're lifting the house with a new foundation, correct, David?
I didn't get into that because whether we do any work on the house at all, or not, this is the same system we would design. So,
right.
Okay.
So they are putting in a new foundation, lifting it, and then everything else, the system itself is going to be raised quite a bit. So it's going to be well out of, elevation-wise, out of the, the flood
The groundwater, yeah.
groundwater. It's definitely a much more environmentally, acceptable system than what's there now.
And the 5 bedrooms are in the existing dwelling, so it's just a continuation of what,
Yes.
yeah.
Basically, four bedrooms and a bonus room is what's there now, and that's what we're proposing with the remodel.
And these variances all relate to the fact that it's an existing parcel with tight boundaries, and this is the best that can be done within the space they have to work.
Judy, Carol?
It does look like it could fit on the side of the house.
They have to, they have setbacks to the dwelling. The leaching area is supposed to be 20 feet from the dwelling, and 10 feet off the property line. So if they squeeze it on the side, then if they squeeze it on the right side, they're that much closer to the dwelling on the neighbor's property, which people don't like. And they would be way too close to their own hut dwelling and their own property line. And the same on the left, and then as David explained, he's got, utility issues and...
Well, the utilities are on the right.
The other thing to consider is when you review projects, you're typically looking at how it impacts public health, safety, and the environment. The coastal bank, although it is a wetland resource area, it's not a wetland. It primarily serves as a mechanical landform to protect inland areas from coastal storms. Putting the septic system either in the front yard or on the side yard, on the Andrew Harding's Lane side, would require a significant variance to the foundation, which I think is more of a public health issue than placing a septic system in or adjacent to a coastal bank. And we also have the water mains. We would be less than 10 feet from 2 town water mains.
Ron, did you have a question about the variance? No. So in summary, I think they're replacing a cesspool with a Title V system that is farther away from the water, the bank. And we're sort of wondering if it could be even farther away, but from what we hear, we don't know that. So is there, somebody would propose a motion? Yeah, Ron.
I have one question. Judy, how long before the town storage is going to go by there? It's right on Main Street.
There's no plans at the moment.
Yeah, honestly, it should be on town sewer now. when the municipal treatment plant was first built, 1969 to late 1970, the first phase was to connect downtown Chatham to the sewer. That was the initial purpose. Second phase was to connect the old village and the Little Beach area. So we went to town meeting in 1971 for money to do that. Between state and federal money, paying 90 cents on the dollar, town of Chatham thought it was still too much money.
They what? They passed on it.
They passed on it. So this area should have been on town sewer since 1971.
So that area, I mean, it will be sewered as part of Phase 1, I believe, but that could be, easily 10 years from now or more. I mean, the good news about this area is it is right on Chatham Harbor. It's a really well flushed area. There's not a nitrogen issue
Correct.
in that area. And as David said, it's a coastal bank setback. I mean, we do like to get it as far away as possible. This is basically all he can really do, given the restrictions on the lot here.
Okay, so other comments or questions? Ed, did you have a question or? No. Okay, if not, Judy has given us a recommendation to approve. Does somebody want to make a motion? Oh, yeah, a motion?
I'll make a motion to approve.
And a second?
Seconded, and
Okay, we have a motion and a second. And I guess we can have Judy read the conditions, and then we'll ask for input from the public.
Okay. The applicant should restrict the property to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of that deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations with written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling will be allowed without further review by the board or its agent.
Okay, so do we have input from the public or someone on the call? No? We can go ahead and take a vote then. We can do it by voice. All in favor, say aye.
Aye.
Aye. All opposed, say no. The variance is granted.
Thank you very much.
Okay, so that's the second. So now we have 3 updates. Bob Duncanson isn't here for this meeting, so Judy will do the updates. And the first one is on John McGrath, 32 Mill Hill Road.
Not too much different from last week. I did talk to Tom Temple today. They're scheduled to put the guardrail in tomorrow morning. They're supposed to be there at 8:30. And I did ask him about the trailers. He said if he gets 2 driveway cuts, but I don't think that one of those trailers is in the driveway. So he said anything that's blocking where it should go will have to be towed. The police will be notified, and it will have to be removed.
I went there today, and it appeared to me that both the trailers are tucked in to the right and do not come out beyond the guardrails.
Okay, so if they're not blocking, they're probably just going to be left there. And
I mean, the
and
corridor looked
They'll be blocked
pretty
in.
wide open when I was there today, easily allowing trucks to go in both directions, in my judgment.
Yep.
So,
And then I asked him also about the no parking signs, whether they were going to continue down the road. And he said he thought he was only supposed to put them up right in front of his property, but he would check, and I will check to find out what the ruling was. by the Traffic and Parking Committee. So
Right, because I think they said down to the road that's down there.
Dusty Miller.
Yeah, Dusty Miller. So the guardrail is going to continue down to the far end of the property, right up to the property line, as you drive in, and then the no parking signs will continue there as well. And any trailer that's blocking that guardrail will be removed. That's our understanding.
That's my
Now,
understanding.
he has the apron, which is technically his driveway, so he can park or something there that's off the roadway, I guess.
Right, right.
I did notice, however, that one of the trailers I saw today had flat tire,
Yep.
not suggesting that it is readily usable. Yeah.
So that's all the news I have on that. We'll see what happens tomorrow morning.
One other thing, you had written to the Department of
Environmental protection, yeah.
I
Environmental
have
Protection
not
for the
heard
state.
back.
Right.
I have not heard back.
And I think Bob said that he knew a couple of people personally in the department that he was going to contact as well, so maybe that'll also be done before our next meeting, when we'll have more information.
Right, we'll see, yep.
How many days ago did you reach out to the DEP, Judy?
It was last Monday, I believe,
So
so
it's been a week.
it's been a week, yeah.
You may want to follow up.
Yep.
I mean, I would think they'd at least respond.
Yeah, I'm kind of surprised
acknowledge
he
that-
hasn't answered me, but I can follow up,
Yeah,
so.
that's what I would do.
Because the plan, once the roadway was finished, which sounds like it might be shortly, then we would begin discussing the second phase, and then we'll gather information, and that'll be, a process.
And
Yes.
we're going to need some DEP advice and guidance on that.
Excuse me, we had talked about doing a site visit, and I was wondering if we could get that on the calendar at all for, the
Yeah, I
near
think that, that'll be the first part of that, and I think to be determined is exactly who's going to go and what departments, and whether someone from the state would be there to help look, fire, police, and organize all that. So, yeah, my thought was just we would finish this phase, which we're close to, and then we
Exactly.
would go to that. So it won't be far away, and we
okay.
can,
And who's going to organize that?
the site visit?
Yes.
It'll be the Board of Health.
Okay, so we'll organize
So,
it.
I'm assuming it'll be open
It'll be
to-
myself and Dr. Bob, and most likely we'll need someone from building and then our fire
But
safety inspector as well.
I think we ought to, before we make that move, ask the DEP to make a site visit and assess what they see and what they recommend as strategies for us. Let's get some of their guidance before we pull the trigger, is what I would suggest.
Right, but that's fine. I mean,
Yeah.
as long as we, get these people on board and have them, participating. Sounds good.
Yeah, so you're suggesting a separate site visit. But yeah, so we'll do that, and then we'll have to see how many of the board members want to go. I'm assuming that most people will want to go, so then it'll be an official meeting. We'll have to post that meeting
It's true.
publicly and go through that whole process.
Do you, excuse me.
Oh, yeah.
Will we have someone from the police department with us at the time?
I would guess, yes.
I would think
Yes.
so, too. Okay.
Police, fire, health department.
And we're going to have a clear discussion before we do this about what exactly are going to be the overarching,
What? I'm sorry.
what are going to be the overarching factors that we're going to be documenting or measuring, or, we're going to have an overarching strategy of what it is we're looking for, what we're not looking for, and how that could then tie in with a plan of how would we approach the partial cleanup or the total cleanup of the property. This is a very important aspect of phase two, in my opinion.
Dick?
So does the DEP have a history of being involved in nuisance complaints that do not involve chemicals and vermin and things that are that are health-related issues, because it sounds like the Board of Health is being asked to deal with the nuisance, which can be just unsightliness that degrades from the neighbor's property. And I find it unlikely that the DEP is going to be very helpful in that regard. If they come and they say, well, there's no chemicals and there's no vermin and there's, it's not a DEP issue, we're still going to be left with the job of dealing with the nuisance issue. If it meets the definition of a nuisance and that it's degrading the value of the neighbor's property or whatever because it's unsightly, we're going to have to deal with that regardless of what the DEP says.
Yeah, I think the DEP would be a matter of what input they would have for us to help us.
Right.
But as I understand it, we took on this as a public nuisance, which means it falls under the state law where the public nuisance is taken care of by the Board of Health. That's different than, as I understand it, and I'm not an expert here, a private nuisance, which would, is a lesser thing, and that would be handled by a tort thing usually between homeowners or individuals. But I think we've already, as I understand it, taken this on as a public nuisance, and under state law from our town attorney, that falls under the jurisdiction of the Board of Health. That's how we wound up with it back. This is a year ago, June.
We had this discussion at the last meeting, and I said that, and then I was told, no, well, the selectmen want the Board of Health to deal with it, even if it's a private nuisance.
Okay.
My understanding, if it's a private nuisance, it only affects the abutting neighbor, then the abutting neighbor has to take them to court, and we have nothing to do with it. But I was told, no, if it's very unsightly, and that we would be asked to do something about that.
I think it does fall under
We've
our
already
jurisdiction.
declared it a public nuisance.
The public nuisance is really supposed to involve
Right.
the whole community.
We did, we already
Exactly.
declared it a
Surrounding
public
neighbors,
nuisance.
It totally
surrounding
does.
property owners. I mean, we've already.
We've already determined that, right?
Yeah, we've already made that definitive finding in earlier notices.
And I'm sure that there are many health violations there. And
Well,
with-
that's-
with the wetlands there and everything else, I'm sure that there are.
But that's to be determined.
Right,
We we know that there is at a minimum a public nuisance. What we don't know, sitting here today, is whether there are other conditions present
Right.
that would add to that.
Did he not have-
Specific public health concerns, groundwater concerns.
Exactly.
Discharge of hazardous substances. We don't know that's true. We don't know what any soil testing would show.
Right. Did he not have other violations issued to him a long time ago that he just ignored? As far as,
It's been declared a fire hazard by the fire department.
okay.
Right.
So that's
We know
one.
that's one.
Yeah.
Okay.
I would say in terms of inspections personally, I think we don't know what's there. So the first inspection is going to be, hey, what's here?
Right.
Their gas cans, are there,
How many violations are there?
and get all that information we can. But that might not be the last inspection. We may get that idea of what's really there and the extent of it in the property and down near the water, and then come back and say, have another discussion about how much we think needs to be done or how you approach that. And then that might even require another inspection where you go in and you mark things off, or you measure distances, or you label things, or whatever. That's the way I'm
Yeah,
thinking.
I would assume that they would, whomever is going to do it, the cleanup will go in and put up flags like they did before. They'll measure off and they'll do the surveying, and then it'll go from
Yeah,
there.
I think we'd have to decide the extent
Yes.
of what's going to be done, and then you get into the contracts and all that, and then it will have to be marked off and just determine exactly what it is. It could go from clean the whole thing, which is a big jump, or you can, do what you think you need to do to take it away from being a public nuisance. But
Right.
that's something we'll determine. I think we don't know everything until we actually walk the property, if
Right.
that's
Exactly.
even
And
possible.
Just to answer Dick, I think DEP would, and John has touched on it, is going to come in, if they probably will bounce it back to us, but they will give us opinions, I think, on what they feel the concerns could be. I mean, they do handle junkyards and tire piles, abandoned properties that have, a lot of tires dumped and things like that are public health. They can cause fires, they can cause
Mosquitoes,
breeding.
mosquito breeding, big
Things like
time.
that. So there's no doubt that there's a public health nuisance there in my mind, but I think DEP it would be good to get a recommendation, or at least have them say yes or no, they will be
Well,
involved.
they've seen many more properties in
Right.
their careers than we have seen, and they may have a perspective that's quite different from ours.
So I guess, so our next step is to get everyone on board to do the site inspection? That would be the next thing?
Yes, I think so. And then that would include the fire department, and what they decide, what they tell us needs to be done to remove it as a fire hazard would be thrown into the whole mix.
Exactly.
There was a lot of wood that I saw, a lot of abandoned, old, dry, little bit rotted wood debris
Right.
that's visible from the top of the
Oh,
hill.
definitely, yes. Can you, do you think we can put, like, say, in 2 weeks, that we'll hear back from the
Well, Judy's going to follow up.
DPW?
We have a meeting on the 15th, so hopefully we'll know
Oh, good.
something by
Okay.
then, so
Terrific, so then we can start.
Yeah,
I'll follow up.
I'd say by the 15th, the roadway work should be completed. Hopefully Judy will have back some more information, and then we can talk about when we would do the site visit. That'll be a whole separate meeting. It'll
Okay.
have to be posted, and it may be outside of this meeting, a different time.
Right.
That gets all the parties together.
Yeah.
Dick, did you have a question?
Yeah, well, the other issue that comes up is that now that the roadway has been cleared and it is really, it looks a lot better than it did. And in fact, as you drive along the street, for the first half of his property, where it goes down the hill, you don't really see much in there at all from the road now because of the guardrail. So now the issue is, if you drive another quarter mile down the street, there's another property which is possibly more unsightly than the McGrath property from the street. And what is our obligation to deal with that?
I think we take one at a time.
Yeah, I know, but, he's gonna come back and say, well, look, how come you're picking on me? And there's this thing that has an operating junkyard right on Mill Hill Road, with that big dumpster that fills up with stuff, and it says the name of a trash company on it, and then the rest of the property's all full of junk, and that's easily visible from the road. So I just.
That's not part of our focus right now.
Right, but it's going to be brought up as an issue, I'm sure. Right.
And that could be next, who knows?
Yeah, I think that's a good point. The initial discussion was that might very well come up. Why are you picking on me? And our answer is, there are a list of things. This is the worst in our estimation, so we're dealing with this first.
Right.
Then there may be more. There may be people point things out. The other big difference, and it came up when we took this on, if it's an illegal junkyard, I believe that's licensed through the select board. If it's a public nuisance, that's dealt with by the health department, by the Board of Health. So that's a later discussion, but it might be two separate things. So the answer is, he's the worst in our estimation, so we're dealing with that first.
Right.
And then go from there.
We'll get them all.
Ron?
Could we get a list of the property that spoken about that are on that?
Yeah, I know I've said I'd get you one. I can only think of one other property right off the top of my head that we've had complaints about. So I know there are other properties around town where there are issues, but I really don't have a list.
Oh, I thought there was a list.
No, there really, there isn't a formal list that I know of, so
I thought there was.
I can try and put something together, but I haven't been able to.
Is the property you're thinking of farther down Mill Hill Lane?
Well, no, that is one of them, I guess, but no, I'm thinking of one on 28, down by, before Drifter, before the Talkative Pig on the right. in South Chatham. There's a property there.
Or, you mean across from Cockle Cove Road, the Clark gas station?
Past, no, past
Not
that. Way down, almost to Harwich, before Pleasant Street. So,
Well, but I think it's important that we keep our focus on what we're trying to,
I mean, this is kind of a test
Now.
case. Now we have this emergency fund, and we have, we're figuring out how to move forward with these. So I think if we can get this one done, and this one had more of an issue because it was impinging on the roadway. It was causing safety hazards for traffic, et cetera. So that's kind of why I think why we were pushed into going after it. So,
but I do think phase one of our efforts, although it took more time than any of us had hoped it would, has been very successful, at
I
least
do too.
in my judgment.
No, I
And
do
we should
too.
feel good about that.
Yes,
we
I
should
think
just
it's a
stay with
feather in
it.
our cap. That's a good,
Yeah.
it's good.
Okay, that's, any other comments or anything to mention on the McGrath property? Okay. All right, that was item 3, so we can move on to Chatham water quality. Judy?
So I don't really have an update on that. Nothing has changed since last week. Bob's been on vacation. As far as I know, it's status quo. They're moving forward with the construction of the new wells, and the treatment facility has gone, I believe, online, and that's going well. You've been sent some updates on the PFAS, and it's doing what it's supposed to be doing. It is removing the PFAS from the well number 8, I believe, or well number 5, I'm sorry. So I don't have anything else on that.
And then you did send out the Tom Temple's report on the well update.
Yes, you got that report on the wells, yep.
Did that go to everyone, or?
I
Yeah.
believe so, yes.
I think so.
Okay, and there's a lot of information in there, and Mr. Temple gave that report to the select board last week.
Right, right. Forgot I gave you that.
Okay, questions on water quality? It was interesting that something came out that showed the amount of water pumped in the month of June was way down this year compared to last year. I don't know if that's because of the weather or because of the water restrictions, but there's been a significant
Yeah.
decrease in water usage for the month of June.
Well, they did put the restrictions in, so I think that has helped. People are being forced to use more conservation methods.
And we
so.
did have a lot of rain in June, too. I think we recharged a lot of the ponds, and
We did, but I think now we're starting to dry out quite a bit.
Yes.
Although, when you look at the drought map for Massachusetts, Cape Cod is not part of it. So we're still okay, but we are dropping.
I walked around Schoolhouse Pond yesterday, and last time I was there, the two ponds were
Connected.
connected with water. Yesterday,
You can go around again, yep.
yes, yesterday there was no no surface water connection
Right.
between the two ponds. So that's clearly gone down a little bit.
Yeah, I don't think the water table has gone up all that much. Yeah, Dick?
Yeah, I think that, again, in my view, Chatham's water problem is more related to an inadequate number of wells and storage capacity for the summer population, which is seemingly much greater than it's ever been before in terms of number of people here and driving around and sitting in the parking lot at Stop and Shop. Much more is a problem of not being able to pump enough water through the existing wells than a problem with drought.
Right.
There's plenty of water in the aquifer. We're not pumping the aquifer dry.
Right.
But we only have so many wells and so many pumps and so much water storage. And if there's a fire in August and everybody's watering their lawn with town water, there might not be enough pressure to fight the fire. That's what's bringing this on. It's not a drought issue at this point. And that's why if you have an irrigation well that's a shallow well, that's not going down into the main aquifer, that irrigation is not as much of a problem. You know, Dr. Duncanson was talking about a clay area that separates
Yep.
the higher level of water that these shallow, homeowners' wells are going into from the deep aquifer that the town wells are going into. But we just don't have enough wells and enough pumps and enough storage tanks for the massive number of people who are here, particularly when we're putting 16 people in a 3-bedroom house in the summer.
Okay. Other comments on, with the water quality? All right, let's move on to the last item, number 5, a COVID-19 update, and Judy will do that as well.
So the state has just switched their COVID reporting from daily to weekly. So you may have heard that on the news. So their numbers are only coming out once a week now. But, we're still getting our daily reports of cases in town, et cetera. So their 14-day average incident rate this week for us was 18.4, which actually went down a little bit. Our positivity rate went up slightly. That's at 8.8. We're about the same as the county average right now. We've had a total of 918 cases in town to date from, the beginning of 2020. This month, we've had 29 cases. It's been fairly busy. We're averaging 7 cases a week or so. DPH is recommending, because they're starting to see some increase in cases from wastewater around the state and in some of the more, the more city areas. They are recommending that people wear masks in crowded areas and that they test themselves before and after if they go to a large gathering, which we definitely, we recommend, and we do have the test kits available, which I say again, we have many of them at the health department that are open, they're available for our town residents. Anybody can come in and pick them up if they need them. So.
Do you have the hospitalization, Cape Cod Hospital?
I do not. I could not find those exact numbers today.
I think it's been pretty steady as it was.
Yeah, from
last
what
few
I'm
weeks.
seeing, it seems it's it's steady. I didn't see anything that looked like it had, gone up too much, so.
But the wastewater testing indicators are beginning to point up.
Yes, in the Provincetown, Plymouth would be the closest for us, and then they have gone up, so, and that's usually a pretty good indication of what's
That is
happening.
a Pretty,
So-
pretty powerful indicator, yeah.
Yeah. So,
Yeah, the bulk of the cases are now the BA.5, that variant, and they expect that in a few months, that's going to be virtually all of the cases, and
Yeah.
that's a
Is
more,
it BA.5 or 6?
I think it's 5.
BA5, they're saying about
And it's
65% of the
It's more
cases.
transmissible than Omicron, but it also tends to not be as severe as the original COVID. And so from that standpoint, people are expecting there's going to be another surge in a month or two in terms of the number of cases. But based on worldwide data from other countries that have already gone through the BA.5 and had the surge, the number of hospitalizations and deaths was relatively modest. So even though we may have a lot of people about to get COVID, right now it doesn't look like we're going to have the kind of problem we had with other surges in terms of.
Plus our immunization percentage is very high.
This BA.5
Chatham.
apparently is relatively resistant to the vaccine.
Really?
But if you've been vaccinated and boosted or double boosted, you have a better immunity to it. But people who have only had one vaccine and people who have had COVID are not felt to have much immunity against this new variant.
Yep.
I have a question. Have any of us heard about any plans for a new booster come the fall that was going to be tinkered with in a way that it would be?
From what I understand, they are looking at that, the FDA, and that they haven't approved anything yet, but there is some talk about getting something like that out
That's
in the fall.
more tailored to the B5.
Right. I mean, the problem is, like with the flu vaccine, you know, once you get, these things keep mutating, so we're going to get to the point where we have to pick which strains you kind of have to guess which strains are going to be the most prominent in the area, which is what they do every year for the flu, and we may be in that same boat with
Okay.
COVID. But they are looking at
Recently-
that, and they're hoping to get something out in the fall, so we'll see if that happens.
The COVID the guy named Czar, who's the czar,
Yeah.
the national COVID czar, he was asked that question, and he said, yeah, they're working on a vaccine that's going to have more Omicron in it and maybe a touch of BA5.
Right.
But they don't have any specific plans for when they would be putting out another booster.
Right.
But probably in the late fall.
Yeah, I think they may be October, but it could be delayed several months.
Yeah.
Okay.
So,
All right.
then I had a question for Judy. On this positivity rate, is that just deal with PCR tests? Is that correct?
Yes, all of these.
So all
I'm sorry, yes, all
this
this-
home testing that's done, and I think the current recommendation is if you have a positive home test for COVID, they don't recommend that you run in and get a PCR test. They recommend you just follow the guidelines.
Right.
So that may skew what these percent positivities are.
Well, yeah, more so the incident rate, I think, the incident rate is the number per 10,000 people, the number of cases per 10,000 population. So it definitely would be skewed because your number of cases is probably higher than what we think it is.
Yeah.
The percent positivity is the number of positive cases per the number of tests that were done.
Right, but at these home tests, you know, I know families that do 20 tests a week. You know, that if the kid coughs, they do a test. And so their positivity rate would be like 1/100th of 1%.
Right.
Because they're testing everything, you know.
But only if they run in and get a PCR test in follow-up, which.
Right, and people don't go in
most
for a
people are not
PCR
doing.
test unless they really think that there's a
Right.
significant risk that they've got
We're
COVID.
looking for a false
So,
positive.
so
So at least we have a level database anyways. I mean, this has been going on now since these test kits have kind of hit the mass market. Our data is basically just our PCR tests, so.
Well, the thought crosses my mind of how come towns don't ask people to voluntarily report a positive home test? I mean, it wouldn't be that hard.
I don't,
the
yeah, I
word
mean, I
out.
don't know what it would prove. I don't think the state really wants that information
No.
at this point. I think we've moved into a phase where we're more endemic and we're more
Okay.
just kind of living with it and managing what we have, and I don't.
I don't agree. What I would say is it would be very valuable to know how many positive cases of COVID there are in Chatham, but people just don't do that. I mean, you can put a sign up saying, please call the health department
Yeah, I
when
mean,
you
people
test
aren't
it, when
gonna-
you test positive at home.
Create a
And then
website.
we'll come over and make sure that you quarantine and you do all the things you're
No.
supposed to do. So nobody's going to do it. They're going to be afraid that they'll be, you know.
We don't have the infrastructure anyways
So-
to
That's
do that.
it's not gonna
That's the
happen.
Real
problem.
reason,
And
yeah.
I think the state got to that point as well.
And these numbers don't include people that come here for 2 weeks vacation.
That's
get
true. That's a
COVID,
good point.
And
Yeah.
then go home.
Right.
And that's been the problem
not-
since day one. I mean, that's always been the problem here in Chatham or any tourist community.
Right.
And then Judy, I had another question on, like, for the Cape Cod Hospital COVID admissions, COVID cases.
Mm-hmm.
Do they break down whether those are all the
Resident.
patients with COVID in the hospital, from those who are admitted to the hospital because of COVID or with COVID. Because they test everyone coming in the hospital, and it's
Right.
so
No,
common.
I
They
think
must be
that
picking
they're-
up a whole lot of cases that
I
are relatively
believe that
asymptomatic.
they do break it out into the people that are there for COVID, you know.
Yeah, I haven't seen that, but,
That'd be something I'd have to check, but hospitalized for COVID.
okay. Any other COVID questions, discussion? All right, then, new business, and first I'll say that the issue of the rental bylaw discussion, and then the calculation of bedrooms from total room numbers in houses, we're gonna put them on the agenda for the next meeting. We couldn't get it on this meeting. Bob Duncanson will be back for that meeting, which I think will be a big help. And Judy's going to gather more information and get it out to everybody so that we have a lot more information, ready for us then. So any other business?
All right, if Judy could just look around and see if there have been any issues in places that use the room calculation from the Title V definition. If there have been any issues about what constitutes a room. Again, in my view, a room would be any place where you could potentially put a bed and let somebody asleep. Not necessarily requiring privacy. So that if you did have a room calculation and a 12-room house was a 6-bedroom house, then we would be able to limit the number of mega mansions built on quarter-acre lots by using loopholes and alternative septic systems. So,
Yeah, I
I'm
think
really
that'll all be
anxious
part
to
of the
go
discussion
forward
when we
with
have an
that.
agenda item, and then other things come into that, occupancy rates and some of that. So, but any other business other than those issues that people have that want to bring up? Ron?
I have one question, Judy. On that letter you sent out to the people for their operation and maintenance contract,
Yes.
do they come back to us? Or it's kind of
I sent them a letter. I've already spoken with him and had several discussions and via email, basically. He is hiring, he has somebody he's hiring. I haven't quite got the contract yet, but hopefully we won't have to come in. But that would be the next step. The county tracks it. What they usually do is try and contact themselves, and then they get to the point where they're not having any luck, and they refer it to me, and I usually
Okay.
send a letter. So this person did reach out. We had some discussion about the type of testing he needed, and apparently he had some health issues and didn't get his contract signed in time, and so the house is not used a lot, but it's more of a summer house. I don't think it's a rental, so he's on it, so we'll give him a little more time to see what happens.
Thank you.
Okay. Minutes.
Yeah, okay, so no other issues. Yeah, so we have minutes from,
Excuse me, Mr. Chairman?
oh, yes? Somebody from the
May I-
outside?
Yes, this is Gloria Freeman.
Yeah?
I just have a very brief statement that, as already stated, at your last meeting, you had a discussion about bonus rooms and attached bathrooms. And in the past, Dr. Duncanson has suggested that bonus rooms in big houses are not topics over which you have authority. I believe that the suggestion was made to perhaps sometime have a discussion with the planning board. But I wanted you to know, if you don't know this, that at the Zoning Board of Appeals meeting on July 14th, last week, they were discussing 32 Ivy Lane. You remember that you approved that application when it was before you, and there were several bonus rooms and several more bathrooms than bedrooms. The ZBA did not approve the application, but instead continued their discussion until October because of many concerns. One issue brought up by a ZBA member was the mass and scale of the Ivy Lane project, and specifically the number of bonus rooms with full baths, several with full double vanities and 2 lavatories, he said. He mentioned that even though the number of bedrooms is not within the ZBA's authority, but rather in the authority of the Board of Health, he thought that this needs to be looked into and perhaps discussed soon among boards, because he suggested some property owners might put in baths and bonus rooms to accommodate more space to use for rentals. I just wanted you to know about this and perhaps consider a meeting among the Board of Health, the Planning Board, and the ZBA to discuss this issue. Perhaps this would be helpful to the ZBA in October when they continue to consider 32 Ivy Lane. And that was it. Thank you very much for letting me comment.
Yeah, thank you for the comment, but I think that's exactly the issue that we've been grappling with here, and that we'll discuss at length probably at the next agenda meeting. And who ultimately takes on a rental bylaw, whether it's done, the parties involved in the town will be an open issue. It's going to be a big issue, so there'll be a number of people with an interest that hopefully would get involved.
Right, and this is not simply a rental issue. If people are building 12-room houses with only 4 rooms that officially meet our current standards as bedrooms, they can have their extended family here for the whole summer and have 18 or 20 people living in that house. And that's putting an excessive load on the septic system at a time when we're trying to decrease nitrogen load. So it's not just a rental issue. When we get these applications for variances that clearly have rooms that are very likely to be used to sleep people, even though they don't meet the standard definition of a bedroom, even if they're not going to rent them, that's a problem. If they have a big extended family and they're all going to be here for the whole summer and have 16 people living in a house that has a septic tank designed for 4 bedrooms, that's inappropriate in my view.
Yeah, I think that's part of the discussion we're going to have, but that's a good point. And I think that gets to this occupancy rate thing, which in some towns, I believe, applies to all homes, not just rental homes.
Right. And I think that's another reason why we need to eventually start looking at bathrooms, because if you have an accessory room and you do not have a bathroom with it, clearly it's probably not going to be able to be to be rented, as likely to be rented. Whereas if you have a 2-bedroom house and you have 2 bathrooms plus perhaps a half, that could make a big difference. And I think that eventually that's something that we need to look at and try to figure out. I know we've never done the bathrooms before, but I think that would make a significant difference.
Okay, any other business that's different than this issue, which we will be dealing with at length in the future, I think? Hearing none, we have the minutes we're going over. Okay, the minutes of July 11th. Does anyone have any additions or comments on that? And if not, can I get a motion to approve?
I'll make a motion to approve the minutes as submitted.
You weren't at the meeting.
Oh,
I'll make a motion
right.
to
A
approve.
motion to approve, and do we have a second?
You weren't
You weren't
here.
there either.
Okay, we're on seconds. So we can take a voice vote. All in favor say aye.
aye.
Opposed, say no. Okay, then those minutes are approved. And then, I guess, do we have a motion to close the meeting?
Motion to adjourn.
Motion to adjourn. And a second? Second. All in favor, say aye.
Aye.
Aye. Opposed? Okay, meeting is adjourned.